Our speaker for today is Dr. Derek Nolan from the University of Illinois Dairy Education and Extension Program. He helps producers reach their goals by providing tools to make informed management decisions and improve milk quality. He focuses on hands-on experiences that help dairymen better understand the dairy cow and dairy production system. He will target strategies that lower somatic cell counts and reduce the incidence of mastitis in today's program. Dr. Nolan, we are very much excited to have you present today. The podium is yours.
Well, thank you, Fred, for the introduction. Really excited to be here. Good afternoon, everyone. And as Fred talked about today, I want to talk a little bit about troubleshooting mastitis in your herd for cleaner milk. And I think to help understand mastitis, we first need to understand the mastitis relationships. Those that are familiar with the National Mastitis Council may have seen something to this similar presented as what we also call the mastitis triangle. I personally like to present it as a Venn diagram, just because without the overlapping relationships of the cow bacteria and the cow's environment, we wouldn't have some of the cases of mastitis that we have. And understanding these individual relationships can really tell us a lot about what we need to do to manage mastitis on farms. So I just want to touch briefly on all of these relationships, and then overall, where all of these circles interlap, they lead to an intermammary infection. So the first relationship I want to discuss is just the relationship between bacteria and the cow's environment. So the relationship between bacteria and the environment lead to really how mastitis cases can be potentially spread, and how these bacteria are also spread around the environment. So keeping the cow's environment clean, both in the housing system, but also in the parlor, is going to determine potentially what bacteria we see on farms and how that bacteria is then spread across the farm and from cow to cow. When we think about the relationship between the cow's environment and the cow itself, I think the most common thing we think about is stress. And if we have a stressful environment, this can lead to an increase in somatic cell count and an increase in mastitis cases. Often we think about stress around the time of calving, so keeping the time of calving when the cow is most susceptible to new intermammary infections, trying to keep that environment as low stress as possible is hopefully going to benefit that cow into reducing mastitis cases. And we also think about heat stress. So managing that cow's environment to keep her cool in those hot summer months, which I don't know about where everybody else is, but in central Illinois, it seems like it's never going to come. We're looking forward to some warmer weather, but as that weather starts to change, how can we manage the cow's environment to reduce heat stress? Because research has shown with an increase in any stress, but heat stress is one we often think about, that the cow's immune system isn't going to function quite like it should. And finally, I think the last important relationship to talk about is between the cow and bacteria itself. So when thinking about this relationship, we're thinking about how that cow was potentially exposed to the different bacteria types. Again, managing the cow's environment might have some to do with this, but if we are not reducing bacteria, there's a greater chance that the cow in that mammary gland is going to be exposed to those bacteria types. And we'll talk about how we troubleshoot those things and what we look for in managing really all of these relationships. So I also want to ask, and I always ask, what is a mastitis problem? Well, this is going to mean something different when we're talking to different farmers or different people in the industry. Some farms are concerned with their clinical mastitis cases. Are they seeing an increase in clinical mastitis? Some farms are really worried about somatic cell counts. And as we've known the past few years, this has become really even more important on the processing side, because the processors now are reducing their threshold for an acceptable somatic cell count. So somatic cell count is often one that we're concerned with and want to measure. Other farms might be concerned with other things, increased use of antibiotics, and increased other signs of mastitis, which we'll talk about here in a little bit. So one farm that we were working with, and we'll kind of use as an example here a little later, they were concerned with septic cases of mastitis. So mastitis problems can mean different things to different farms, and how we can tell if it's a problem comes in how we measure it. So this is a figure that I like to show. It's focused mainly on business intelligence and how different businesses become more competitive in their marketplace. So we can see here, we have the different competitive advantage by different reports that these businesses take. We can kind of ignore this column. I'm more interested in how are we able to answer these questions. And the more questions that businesses can answer, the more competitive they are in their marketplace. I switched this. I think there's a milk quality addition to this graph, and we'll talk about that here in a little bit. But on our milk quality addition, I think we often stop at this question. When it comes to measuring clinical mastitis cases or somatic cell count, I think we often stop at these ad hoc reports, which help us answer how many cases of mastitis do we have, how often do we have it, and to answer where, is there a certain group of cows that we often see infected with a case of mastitis. But even with these specific reports, I think we also want to answer the question of how do we use the information. With bulk tank reports, these are great reports because they give us an overall look at the herd. We can measure our herd somatic cell count for every pickup and try to determine what trends we're seeing at each of these individual pickups. With our bulk tank reports, we can often add cultures as well. So getting some culture information on the tank might be beneficial as well. For those that are interested or enrolled in DHIA or have some other kind of individual cow test, I think these are a little more beneficial because now we're given a little more information. We can see trends to help us answer the question of how many. So how many cows are above a somatic cell count threshold, or how many, if we're recording our own information, how many cows do we see with clinical cases of mastitis, and where. So if we have discerned in our records, which cows are fresh cows or which cows are second or greater lactation cows, it gives us a little more information to help us answer those questions in that ad hoc report of how many, how often, and where. Now that we've seen a lot of research coming out of using inline sensors and cow side tests where we can have this information at every milking. Now the challenge in this one with these tests really become of answering the questions of how we use the information. Because somatic cell count can change so rapidly. So just because a cow has one high test in an inline sensor, if one milking her conductivity or somatic cell count comes back high, do we need to make a decision right away? And I challenge us to say no, that maybe we need to wait to see, if we have a few milkings in a row where our conductivity or our somatic cell count is high before we make a management decision. So there does become a threshold with how much information do we need to collect to help us optimize how we use the information to make a better decision. So those that do use PC DART or enrolled in DHIA, I always joke, I'm kind of a cow nerd. I have a favorite graph. This is one of my favorite dairy management graphs because I think it gives us so much information. So the layout of this graph is on the axis here, we have from the herd's current test, the somatic cell score of all the cows on the test. Versus on our x-axis here, now we have the previous test somatic cell score. So the herd I was working with at this point, they test every month. So now it's giving us an idea of how does our infection status change from 1 month to the next. And you can see we have the black crossbars here. These are set at a somatic cell score of 4 and 4, which relates to a somatic cell count of 200,000, which has been our threshold of determining whether or not the mammary gland is potentially infected with a case of mastitis. And research has shown that that threshold of 200,000 has been pretty consistent. But by putting these black crossbars in, it now breaks this graph into a quadrant. So in our lower left-hand corner, we have all of our healthy cows. These are cows that had a low somatic cell score on the last test and a low somatic cell score on this current test. In our upper left-hand corner now, we have our new infections. Those are the cows that had a low somatic cell count on the previous test, but a high somatic cell count on our current test. Our upper right-hand corner, now these are our troublemakers or our chronic cows. These cows have had a high test over 200,000 now for 2 tests in a row. And in our bottom right-hand corner, we have our cured cases. So those cows that had a high somatic cell count on our last test, but a lower somatic cell count on this current test. And the reason I like this graph so much is because depending on how many cows are in each quadrant, it gives us an idea of how we can start troubleshooting a potential mastitis problem on the farm. If we have a lot of cows in the new infection corner, we want to think of what have we changed or what has changed in the cow's environment within the last month that we see this new increase of new infections. Was it a management change? Did we do something different in the parlor? Has it been a change due to weather? Like we said in Illinois here, it's been uncommonly wet recently. Is it just harder now to keep that cow's environment clean? When we're considering the new infections, we want to think about what's changed since our last test, and do we need to revisit the potential changes that we may have adopted? With our chronic cases, if we have a lot of cows in our chronic corner, this may be due to a few different reasons, but one reason I evaluate the chronic corner is because there's a few different bacteria types that like to hang around in the mammary gland. Staph aureus being one that can cause a cow to test high for 2 tests in a row. So now, and we'll talk about here in a little bit, but we can start looking at individual records on these cows to determine if a more stringent management change needs to be taken for these cows. And finally, in the cured corner, when evaluating the cured corner, I try to equate this to of how well are we adopting our management changes or our treatment strategies. So if we've had a lot of cows in the cured corner, potentially things we've adopted in the last month have been beneficial, and it really lets us know whether or not our treatment strategies have been successful. So if we're gonna treat cows to help treat mastitis, do we see a lot of cows drop, especially those cows that have been treated, drop into this cured corner to let us know that our treatments are being successful. On the next graph here, I have our current somatic cell count by our days in milk. And here I've broken out into quadrants again. Here we have our current somatic cell count versus the days in milk on our last reference date. So in the quadrants, I have my somatic cell count threshold at 200,000 again. And here I have my days in milk bar set at 50. This, when evaluating this graph, if we have had a lot of cows in this upper left-hand corner, this lets us know that potentially we're and cows in that transition period. So cows in the transition period and right after dry off are the cows that are most susceptible to cases of mastitis. So if we have a lot of cows in this corner up here, we want to think of management changes that can be adopted, or do we need to go revisit this cow's environment to ensure that it's a low stress environment? We're keeping the bacteria count down by keeping bedding and everything in the environment clean to help reduce the exposure as well. Now, if we see a lot of cows out with a high somatic cell count later in lactation, this gives us an indication that maybe we're not managing those lactating cows' environment the best. Do we need to revisit how we manage the cow's environment? And we'll talk about ways we can determine whether or not we potentially are having issues at managing the cow's environment there. And then our next graph here is our test day 1 versus our previous lactation's last test. So this is set up the same as the graph I showed a couple graphs ago, but now we're looking at that first test of the current lactation versus the last test of the cow's previous lactation. So now cows in our healthy corner had a low somatic cell count at dry off and a low somatic cell count as they calved in, and we collected that first test. Our new infections are cows that had a low somatic cell count at dry off, but then at a high somatic cell count in their first test of the current lactation. So sometime during the dry period or right after calving, that cow had a spike in her somatic cell count. Our chronic cows, again, are those troublemakers that had a high somatic cell count at dry off and a high somatic cell count in their first test after the lactation. And then finally, our cured cows, again, had a high somatic cell count at dry off and now a low somatic cell count as they've freshened in and we've collected that first test. Again, I like this graph a lot too because it does give us a lot of information. If we see a lot of new infections, again, these infections had to occur either within the dry period or shortly after calving. So if we see a lot of new infections, we might start troubleshooting at how well are we managing the dry cow environment and that fresh cow environment. Because at some point, she was potentially exposed to new bacteria, and we may need to manage the stress level as that cow comes into calve. Our chronic cases tell us whether or not our treatment that we have adopted have been successful. So if we're using blanket dry cow therapy, are we potentially using the therapy correctly? Are we administering the antibiotic in the mammary gland correctly? If we're using blanket dry cow therapy, or selective, excuse me, if we're using selective dry cow therapy, is our selection criteria stringent enough? Are we catching all the cows that we're supposed to? And we'll talk about an example of that here in a little bit. And finally, our cured tell us a lot of the same of our chronic. If we have a lot of cured cases, this lets us know that what we've adopted for a dry cow therapy is potentially being successful here. The last image I want to look at when it comes to PC DART and DHI reports is our list of troublemakers, our high somatic cell count cows. With this group and this report, there's a lot of information here, but I want to point out just a couple things. In the report, we get the cow's current test versus the cow's previous test. So I like this report a lot because we can quickly walk through and look for chronic cases of mastitis. So we can tell here, Cedric, our top cow here, would be considered chronic because her previous test was above 200,000, along with her current test of well over 9 million. So we can quickly walk through and determine, do we have a lot of chronic cows, and what potentially do we need to do to manage these chronic cases? The other thing I really like is that this report also includes the percent of the herd somatic cell count. As we talked about, farmers all have different goals for the farms they're working with, or for their farm. So some farms that we're working with have consistently a low somatic cell count and do a really good job managing their farm and managing milk quality on the farm. And when their somatic cell count gets above 250,000, they're concerned and want to change a management practice. First, I think it's important that we look at this report, because in this herd, as an example, the top 2 cows make up over 30% of the herd somatic cell count. So I would suggest to this herd that we have a cow problem, not a management problem. We have 2 cows that are causing trouble and increasing our overall herd somatic cell count. So now, rather than making a drastic management change, maybe we look at a little more information about these 2 cows to see what we need to do to not only prevent future cases of having cows that create or really have an impact on our total herd somatic cell count, but is there something else going on with these cows that we can help manage? Now, I realize that this report is going to be more impactful for smaller herds. So I think the farm we're looking at here is around 100 cows. You know, as we get into larger herds, the impact that 1 or 2 cows is going to have on the herd somatic cell count is going to decrease. But even for the larger herds, I think this report still gives valuable information, because the other thing I like is that it includes the group number. So if we have multiple milking groups in a herd, we can quickly look through this group list and determine if one of our group numbers is a lot more common than the other. And we can take it a step further and then manually add the percent of the herd somatic cell count that cows from a specific group make up for our whole herd. So if on a larger herd, if we see a lot of cows from this group number or the same group number pop up, we want to determine what's going on with that group and how potentially do we need to manage that group differently. So back to our business intelligence graph here, our milk quality edition. So as we talked about before, I think oftentimes when trying to measure milk quality on the farm, we stop at when we're able to answer these questions. How many cases do we have? How often are we having new cases of mastitis? And potentially what group of cows do we see the cases in the most often? However, I think by taking just a little more information, we can answer these additional questions. You know, what exactly the problem is, what additional actions are needed, and potentially why is this happening? And I think by adding on some kind of milk culture program, we can easily, sometimes maybe not so easily, but we can get an idea of how we can answer these questions. So by taking a milk culture, we potentially know what exactly the problem is, because now we know the infecting pathogen. With a little more information about the pathogen, we can determine what actions are potentially needed, and we can potentially determine why this is happening. So depending on the pathogen type, and we can determine where was this cow potentially exposed to this bacteria. So this brings up the question, if we want to adopt culturing, which cows on the farm should we culture? First, I think a good group to culture is those high somatic cell count cows, because as we talked about with the DHI data, somatic cell count changes rather rapidly, and just because the cow's somatic cell count is currently high doesn't necessarily mean that she's still currently battling, or there's still bacteria in the mammary gland. So it might be a week or two after our test from DHI that we get our results back. We want to determine, does that cow still potentially have a case of subclinical mastitis? We also can consider CMT test here, just as a quick cow side test to determine whether or not the somatic cell count is still elevated. Any clinical cases of mastitis are also potentially beneficial to culture, just because it gives us a little more information on what bacteria type is causing the problem for that cow. Any cows during dry off, especially if the farm is adopting selective dry cow therapy. So cows, 2 days or so before dry off would be great cows to culture to determine if there's bacteria that's in the mammary gland. And if so, then those cows should probably be treated with an intramammary antibiotic. And one that we don't talk about as much, but I think there's a lot of potential here, is culturing any cows that we did treat. So if we had a cow with a case of clinical or subclinical mastitis and we decided to treat her with an intramammary antibiotic, I think we can take a culture of that cow 14 days after we started the treatment, because this will help us determine whether or not that treatment was successful. So if we've treated the cow, we take the culture and there's bacteria growth on the plate, this lets us know that the treatment method that we've adopted in this case, or applied, was not successful. And if there's no growth, then we hope that treatment was successful. Taking a mastitis culture also helps us understand these different relationships a little better, especially the relationships between the cow and bacteria and the environment. Now, by knowing this bacteria type, we can determine potentially where that cow was exposed to the bacteria that resulted in an intramammary infection, and we can potentially determine how that bacteria was spread around the farm, or at least spread in the cow's environment. So by taking a culture, it really helps us understand our mastitis relationships a little better. So I want to walk through just a couple of examples of some of the benefits that we've seen from taking individual cultures. So here's a cow that was on one of our extension projects, that we took individual quarter samples and tested them for somatic cell count, and then took individual quarter cultures as well. So you can see when the somatic cell count came back, this cow was high in 3 of her 4 quarters. She had a somatic cell count in her left front of 350,000, her right front over 1 million, and her right rear just above 400,000. We then took cultures from the same cow at the same time that we took this somatic cell count sample as well. And here's the culture results. And you can see, and we plated them on 2 different plates. We got the same bacteria growth on both, that we only had growth in those right quarters. So our right front quarter and our left front, or right rear quarter both had bacteria growth. So one also thing to point out is that the bacteria was different. So each mammary gland or each quarter is in the mammary gland is separate. Just because we have two quarters that are high doesn't necessarily mean that they're infected by the same bacteria type. The other thing to point out is that this left front quarter was high. It was the somatic cell count of over 300,000, but we didn't see any bacteria growth. So this lets us know that hopefully those somatic cells were doing their job and have that bacteria count low enough that we weren't able to pick it up on a culture. And the bacteria or the somatic cell count hasn't quite dropped yet from that infection. So with this, the two different bacteria types that we had here in our right front quarter was Strep uberis, and our right rear quarter was Staph chromogenes, or a coagulase negative or a non-Staph aureus. Just to point out here, so I did throughout my graduate career at the University of Kentucky, I was a part of a large extension project that included multiple universities called the Southeast Quality Milk Initiative. And we developed multiple tools for farmers to help troubleshoot mastitis on farm. This is one that I still use a lot because it has our different classifications of bacteria types, the specific bacteria, and then how that bacteria, where it comes from, such as the source, how the bacteria is spread, what we can do to help control that bacteria, and then working with your veterinarian a potential treatment for that case of mastitis caused by the specific bacteria type. So again, I have this laminated. I keep this in my toolbox all the time to help give a little more information of how we can interpret some of these culture results. So now by using the culture information that we've had, we can hopefully at least determine if the bacteria was an environmental bacteria or if it was a contagious bacteria. So it helps us start with the troubleshooting process. If it was an environmental bacteria, we might want to look at hygiene or manure scores, T10 scores, and revisit our milking procedures. If it was a contagious bacteria type, then we want to look at our T10 scores and our milking procedures in the parlor. I do highly suggest that we take these regularly. We do not wait for this for mastitis to become a problem before we start taking some of these scores. So making it part of our normal parlor routine to once a month or once every couple of weeks, take a hygiene score and some T10 scores can help us curtail the problem before our mastitis problem increases on the farm. So with that, just other hygiene scores, I like the simple score of 1 to 4, 1 being free of dirt and 4 being completely covered. We want about 85 to 95% of our cows to fall in the score of 1 or 2. When it comes to T10 scoring, there is a lot of different T10 scoring guides out there, especially when we're doing these in the parlor. Try to keep them as simple as possible. So one of the simplest ones is just a simple score again of 1 to 4. 1 or a score of N being there was no ring on the T10 present. A score of S or a 2 would be a slightly smooth ring present. And then a score of BR or 4 would be a very rough ring present, where not only is there a ring present, but now that ring is starting to crack and chap. We also want to consider our milking equipment function, system, vacuum. I just have a few guidelines here of what to look for when testing your milking equipment. Too much vacuum can cause additional stress at the teat end and can lead to some of these teat end problems. too little vacuum can actually increase pressure in the milking unit and then cause milk to shoot back up into the mammary gland and through the T10. So these are really important when measuring, again, those and looking for and trying to troubleshoot contagious mastitis. When it comes to the importance of milking procedures, what we have here is a milking time graph that measures vacuum throughout the milking time. And what this graph is showing, you can see how our vacuum has decreased. So our blue and red lines here are our vacuum. They've decreased, they've increased once the cow is milking out of the teats in the gland cistern, and then they've decreased again or increased again here. So we see a sharp increase in blue, we see a decrease, and then an increase again. What this is showing is a bimodal milking. And what a bimodal milking indicates is that the cow is milked out of the teat cistern and the gland cistern, but has not let the milk down out of the secretory tissue yet. And this usually is caused by either the cow is coming into a high stressful environment in the milking parlor. So we want to keep things as low stress as possible in the milking parlor, or we have improper timing of our milking procedures. And we just have not allowed that oxytocin release to happen before we put on the milking unit. So visiting and retraining on our milking procedures becomes very important to help us avoid this bimodal milking. Because now what we see is the cow takes longer to milk out, the milking unit's on the cow longer, and we can potentially do more damage to the teat end here. Other ways we can use culture information. So we've talked about how we can use it to understand the relationship between the cow and her environment and the environment and bacteria. The other information here, which becomes really beneficial, is it helps us find trends in our herd. So one herd that we were working with to help with a mastitis problem, in this case, they were concerned with, they saw a lot of systemic cases of mastitis. Other information on this herd, they consistently have a somatic cell count under 100,000 or just around 100,000. So somatic cell count to them wasn't as important. Of their mastitis problem to them was there's these systemic cases, and oftentimes it led to them losing the cow. A little more information on the farm is that this farm was using selective dry cow therapy. And we can debate the difference between selective and blanket dry cow therapy. But with a herd under or just around 100,000, I think what they're adopting and what they were using has been beneficial for them. And this is going to be really independent for each herd. What we did notice is a lot of these cases that were systemic were being caused by Klebsiella. And they were being caused right around the time of the dry period. So we asked the farmer for a little more information, and they were using history of clinical mastitis and the cow's previous test for DHIA to determine the somatic cell count threshold in which the cow needs to be treated. Anything on that last test of 200,000 was treated with an antibiotic. But as we've talked about before, those DHI records, some of the last tests can be a month away. So there's a potential of what happened here is some of these cows at dry off were getting a case of Klebsiella later in lactation after that last test. So we asked the farm to start doing some on-farm culturing 2 days before dry off, and in a simple culture method where if there's growth on the plate, then the cow is treated with an antibiotic. And since then, they've drastically seen a decrease in these Klebsiella cases, and thus then the systemic cases of mastitis. If you are considering adding culturing as a management practice on the farm, Some of the things you need to consider are the materials, specifically which incubator you would like to use, and we'll talk about that here in a minute. But the other thing is the space. It's important that we are keeping and we're collecting an aseptic milk sample, but we're also plating that milk sample in a very clean environment. So do you have a space on the farm in which you can keep clean to put your incubator in and to start plating your milk cultures? There's multiple different culture media out there, and I'll talk just a little bit about one we like to use. And you also need to consider the cost. So the cost of an incubator is going to be anywhere between $50 for an egg incubator to you can spend close to $500 for a larger incubator on the farm. This is totally personal preference. I've seen farms have really, really good luck with these low cost incubators. I am a big proponent of the Minnesota Mastitis Lab. That's where I order all of our material for our lab here and for our extension work. And the last time I checked, some of the media was around $3 a plate, and collection bottles were around 30 cents per bottle. The disinfectant that you're going to use, cotton balls and an alcohol, is going to be pennies on the dollar per cow when it comes to the cow per case. So not including the cost of an incubator, you're looking at $3 to $4 per culture when adopting on-farm culturing. When choosing a culture media here, again, like I said, I'm a big proponent of the Minnesota Mastitis Lab. I like their tri-plate because it gives us a little more information. Depending on where bacteria grows on this plate, it lets us know what potential bacteria we're dealing with, and then we can tailor our treatment plan or our management plan based on those bacteria growth. You may be wondering, is culturing feasible? Here is just one study looking at the factors that affect on-farm culturing. And I just want to point out two graphs that they presented in their paper. But basically what they did in this paper is looked at two different treatment decisions. One, no matter what the case of mastitis was, the cow was treated for the case of mastitis. The other, the cow was treated for the case of mastitis depending on what grew on the plate. And what they found is that the difference in cost, either using on-farm culturing or not using on-farm culturing, was highly dependent on the proportion of gram-positive cases, which gram-positive bacteria are the ones that are most susceptible to antibiotics. The difference in the cost was highly dependent on how many cases of gram-positive you had on your farm. The more cases of gram-positives that you had, where 60 to 70%, just as an example, the more cost-effective it was to actually not culture, because as we found out, there are specific bacteria types that on specific farms grow better. So once you have a baseline for what bacteria you typically have present on the farm, it's not going to deter your treatment decision to know for sure. So if the majority of your cases are caused by gram-positive, you're going to have the best luck treating most of the cows in the herd. Now, the difference here is these farms that they saw a negative difference, which meant that the greatest benefit was to actually use your culture information, is these farms here used the culture information to make their treatment decision. So when you use culturing to help you make a more guided treatment decision, you're going to have a greater cost benefit to adopting on-farm culturing. But the same here, until the farm found out that most of their cases were caused by gram-positive, and they would most likely treat the case with antibiotics anyway, then they're no longer using the culture information to make the treatment decision. So if the culture information is used to make a treatment decision, then they saw a potential impact here for culturing being feasible. What they found though is that time and accuracy of the culture is really important, and the results of the culture are going to impact your total cost, because some bacteria types for lactating cow therapy. I think if we do a little more research on how farms can use on-farm culturing to help select cows for selective dry cow therapy, or even the use of on-farm culturing to change management decisions, I think we would see that culturing, on-farm culturing would be more feasible. This also brings up the question of, we've troubleshooted the mastitis cost, we've troubleshooted the potential mastitis problem. Is it worth adopting a management practice or changing our management practice to reduce the cost of mastitis on the farm? And this was first looked at by McInerney and colleagues in 1992. And what they suggested is that if we're trying to determine whether or not a management practice is feasible, we need to determine how adoption of a management practice is going to change the total cost of a disease on our farm. So if we look at the total cost of a disease, it can be broken into the equation of C equals L plus E, where C is the total cost of the disease, L is the losses, which is any benefits taken away. So if in cases of mastitis, it might be lost milk production and loss of premiums. And then E is our expenses. So anything that we've used to manage the disease on farm. Bedding costs, treatment costs would be examples of our expenses here. And what McInerney has found is that you can graph your losses and your expenses. And now if we would do absolutely nothing to manage mastitis on a farm, we're going to have our cost of mastitis is going to be due solely to our losses. We're going to have a maximum cost due to losses alone. Now we can adopt management practices, which was going to cause our control expenses to increase, but they're only going to get us so far on our losses. So if we adopt one management practice, our somatic cell count is going to drop so much. So we're going to see some benefit to reduce somatic cell count, but we also need to consider the cost of that, or that expense of that management practice. On the opposite end, we can adopt every management practice under the sun, but there's going to come a point where we cannot reduce our mastitis incidence or our somatic cell count any further. This is considered the technical optimum. We've decreased our somatic cell count as low as it can go. And so we're going to still see some cost of mastitis due to our losses, but we're going to see the majority of our costs due to our expenses here. However, there comes a point before the technical optimum in which an economic optimum might be reached. This economic optimum is saying that for every dollar that I spend on a management practice, I'm going to receive $1 back in reduced losses. So if I am spending $1 and getting $1 back from reduced losses, this is where I want to be as far as an economic optimum. So they looked at 3 different management practices here to determine how teat dipping, dry cow therapy, and milking machine maintenance may impact the total cost of mastitis to a farm. I know we're running short on time, so I'm gonna go through this one pretty quickly. They looked at 500 different herds and looked at the different management practices in which these farms adopted. So in the results here, you can see that the different management practices were also broken into how the farms adopted them. So did they use teat dip all year round, or did they not use any teat dip at all? Did they use a blanket dry cow therapy all year round? Did they not use blanket dry cow therapy at all? And did they perform milking machine maintenance annually or not at all? And what McInerney and his colleagues found is that farm 1 here had a mastitis cost to the farm of just over $3,000. Farm 18 had a cost of just over $5,000, but farm 10 had a cost of mastitis that was over $5,500 per year. Now, what these different groups or farms represent: group 18, so our group farm here, did not use a teat dip, did not use any dry cow therapy, and did no milking machine maintenance. Group 1, our farm here, completed all 3 management practices. So they used a teat dip all year round, they used blanket dry cow therapy, and they performed milking machine maintenance annually. Finally, then group 10 used a teat dip just part of the year, dry cow treated just some of their cows, and performed milking machine maintenance. So the main point and the main takeaway here is this group 10 had those added expenses from adopting the teat dip and using dry cow therapy, but they were not implementing them as they should, so they were not seeing the benefit of decreased losses. So in conclusion, here, the way we adopt management practices, is very important on whether or not they will be feasible. If we adopt a management practice but don't adopt it correctly, we have the added cost of that management practice and don't see the benefit of reducing our mastitis cases or our somatic cell count. We also had the question, and I'm going to wrap up, I'll go through these really quick, but we also see the question of, I'm a farm at 200,000 somatic cell, can I reduce my somatic cell count to 150,000 and still make money? So we looked at this question using DHIA data from Holstein herds in the US, and we looked at the average herd size of around 200 cows, with the average at that time was for test was around 250,000. We looked at whether or not these static variables such as herd size, but more importantly our stochastic variables, are variables that we want to account for in variation such as milk price. So milk price may be $15 and one time we look at it, it might be 20 the next, or it might be 22. So with a stochastic variable, it allowed us to look at 1,000 different scenarios. And with those scenarios, we calculated the total cost of the somatic cell count to the farm. And the total cost was, we again considered losses and expenses. Our losses were milk loss and loss of premiums. And we'll share this presentation, but we looked at different milk loss associated with different somatic cell counts that the farm might have. And we also looked at a 1/4% or a quarter, 25 cents per hundredweight in premiums for the farm as well, based on where they fell for their current somatic cell count. Their expenses, we looked at if they wanted to adopt a new management practice, which could range anywhere from 37 cents per cow per year to almost $60 per cow per year. Those that are interested You know, 37 cents is going to be about the price of your teat disinfectants, where $60 may be cost of a feed additive. And we wanted to look at, based on changing milk price, changing herd somatic cell count, and changing the cost of the management practice, would these management practices be feasible to adopt? And what we found, and farm A, B, and C are farms with at a different level of somatic cell count, that in most scenarios, a farm could adopt a management practice and still make money. Even so, here with the premium, now we see even when no premium is offered, farms with a lower somatic cell count represented by farm A, here not all scenarios made money. So if a farm is not receiving a premium and already has a low somatic cell count, they may not see much of a benefit from adopting a new management practice. Where farms with that average somatic cell count of 250,000, or our upper farm was around 400,000, they still have the potential to make money by reducing their somatic cell count. The main point I wanted to make comes here in the next few graphs. This looked at the total benefit of the farm reducing their somatic cell count. And here we're looking at it based on the change in overall herd somatic cell count. So what you can see is that we, for most scenarios, see a positive benefit for the farm in reducing their somatic cell count. But we see a large jump here in this top herd, in these cluster of scenarios. And this cluster here is the group that received a premium. So we saw the potential for the farms that if they reach that premium structure, they can increase the potential benefit of reducing their somatic cell count by close to $10,000. Same situation here. We have the benefit of the herd somatic cell count by the management practice cost. So this is looking at, does the cost of the management practice impact whether or not we will see a benefit of reducing our somatic cell count? In this case, those upper herds, or this upper cluster of scenarios, again, were farms that reached the premium level. So they could spend our maximum of close to $60 per cow per year and still make money by reducing their somatic cell count. However, those farms that did not receive a premium cannot spend near as much and still make money. And what we found is that the threshold in this scenario was around $27 per cow per year. After $27 per cow per year, in the scenario that we looked at, there was no situation or scenario in which it was economically feasible. So just to wrap up now, again, I think to understand how we troubleshoot mastitis, it's really important that we understand the mastitis relationships. We know mastitis is a really complex disease, and milk quality goals, whether it's somatic cell count or clinical mastitis incidence rate, they have to be farm specific, because if we're not addressing the individual needs of the farm, not always can we actually troubleshoot the problem. And we cannot troubleshoot a problem if we're not taking measurements and collecting information that will help us lead to and understand those mastitis relationships. One way we can understand those relationships a little better is to use some kind of culturing, on-farm culturing. And it does show some financial benefit, but I think more research needs to be done in this area. And before we make a management decision, well, I think we need to consider how the adoption of that management practice is going to impact the total cost of mastitis to the farm. And hopefully then this can make us or help us make a more educated decision when it comes to how we manage those mastitis problems. So with that, I know I ran a little over, but I want to thank everybody for their time today and would be happy to answer any questions. I do have my contact information here, so if you do have to jump off, please feel free to shoot me an email or give me a call, and I'm happy to help you out any way I can. Thank you.
Thank you very much, Dr. Nolan. If we've a small group here, if you have questions, go ahead and unmute and just ask your question. While we're waiting for some folks, we've got a couple questions that came in on the chat box. First, how does high somatic cell counts affect protein and butterfat when we're talking about the income from the milk?
That's a good question. So we constantly always see the relationship between somatic cell count and milk production. We do see just the relationship is not as strong on individual components, but we do see a little bit of decrease in each of the components with an increase in somatic cell count.
Okay. Second question that did come in was on your first PC dot chart, you had the crosshairs at 200,000. Can that be moved? If you heard that really is on the ball, can you move that to 175,000? Yeah, I mean, and get the same information.
Yeah, of course. Yeah, you can move both of those crosshairs, both the one that's associated with the current test and the one that's associated with the previous test, anywhere you'd like. So that's a great point. That some farms that we work with that are really trying to narrow down specific cows or a specific group, we might adjust those crosshairs to best fit the farm. Again, I think the more we can individualize our reports and our guidance for these farms, it is the best. So yeah, great question.
What about changes to bedding sources? Any cost benefits done for changing from mattresses, sawdust to sand?
That's another good question. We often know look at some of the research to determine specific cost. But I think the important thing here is management. So I've been on farms where they bed with sawdust or have some kind of mattress with a thin sawdust layer on top, that their somatic cell count's consistently low because they are taking the time to ensure that their beds are clean. They're making sure that the bedding going into the stalls in the barn is dry. And the opposite. I've been on farms where they bed with sand bedding that cows are having a hard time using the stalls, or the bedding's not clean. Sand is only an inorganic material until we add manure and feces. So if we're not doing a good job making sure we're keeping those beds clean, that can cause a problem too. So again, I think when it comes to determining whether or not we want to change a bedding type, I think we need to think about too, will our management change with it?
Okay, one of our international guests has asked, what should be the frequency of T10 scores on the farm?
I think that's a really farm specific, because some of these scores can take some time. So, you know, and cow throughput is really important and we don't want to we don't want to lose cow throughput. So I think, whatever works best for the farm, and even doing individual cows. So on larger farms, we might suggest doing the fresh cows in the fresh cow pen and then score them again at 60 or 90 days in milk to see how it's changed. Because we hope that, some of those fresh cows are coming in with a healthier teat end. And now how is that changed in 30 days or 60 days to determine if we're having trouble with with our milking equipment function, our management in the parlor. That is going to be farm specific, but having it, once a month may be a good place to start.
Very good. We know over time that we have seasonal changes to mastitis and somatic cell count. So what should we implement to help manage these changes as the seasons change?
That's a great question. And again, I think we see a lot of farms that do a really good job where they don't see those seasonal changes as much. And I think what those farms really stick to is trying to keep those cows comfortable and making sure we're keeping that environment as clean and the cow has a clean, dry place to rest. So I know, one of the farms we worked with, they did an excellent job at keeping their cows cool, but all of a sudden in the spring, they were seeing a peak in somatic cell count, and one area that we looked at and led to some of the problem was how their bedding was stored. So the use of their bedding, the bottom layer of their bedding got pretty wet. They were always scooping their bedding up from the bottom and weren't applying the driest bedding they could to their bed. So I think when it comes down to it, helping, adopting and potentially investing in those strategies to help keep cows cool in the summer, but really ensuring that we're doing a good job managing the cow's environment and the bedding in the cow's environment to help reduce that exposure by limiting the bacteria count in the cow's environment.
Very good. I'm not seeing any new questions coming in on the chat. I do have one question. Is the reference sheet you showed available in Spanish?
That is a good question. I will have to go back and look for sure. I think it's been a while since I've looked. I thought we had all of our works translated, but I'll go back and look, and if I can find one, I'd be happy to provide it to anybody.
Very good. Again, thank you very much for the presentation. You shared a lot of great information with us that's going to be hands-on and useful for producers.